So welcome back. In today's video, we're going to be talking about two medications, Vortioxetine or Trintellix and Vilazodone or Viibryd. And we're going to be comparing these two medications as a few of you have asked me specifically to compare these two medications to figure out which one would be the best for you. So without further ado, let's get into it. So, starting with number one, what are these medications used for? Well, both of them are considered multi-modal antidepressants and specifically working with the serotonin transport system. When we look at Vilazodone, Vilazodone is specifically working on the serotonin reuptake transport system, like all of the SSRIs. It inhibits the reuptake and release of serotonin, allowing for more serotonin to be available in the synapse. However, it's also a partial agonist on the 5-HT1A receptor. So it's also known as a serotonin partial agonist reuptake inhibitor, or SPARI, S-P-A-R-I. So this action specifically boosts serotonin, but also with that partial 5-HT1A agonism, that has some downstream effects in the prefrontal cortex for increasing dopamine, which can have some pro-cognitive effects and also boost mood in depression. Now, when we're looking at Vortioxetine, again, it's also a multimodal antidepressant, but it works on various other serotonin transport systems and serotonin targets. So just like Vilazodone, Vortioxetine also has SSRI function or inhibits the reuptake of serotonin, leaving extra serotonin in the synapses, increasing that serotonin there so that it can help boost mood. It also works on 5-HT1A, but the difference is instead of being a partial agonist, it's a direct agonist of 5-HT1A. When we talk about multimodal action, Vortioxetine really takes that definition to the next level because it's not only affecting the 5-HT1A, but it increases serotonin by 5-HT1B and D presynaptic antagonism and 5-HT7 antagonism. And though this may sound paradoxical or opposite, antagonizing these neurotransmitter sites actually increases serotonin. Now, Vortioxetine also has many other actions, which we'll discuss here, that increase dopamine, norepinephrine, glutamate, histamine, and acetylcholine. And this is primarily done within the prefrontal cortex. So that's why it's not going to increase anxiety because it's doing this in the prefrontal cortex, which helps to boost memory and cognition. Now, Vortioxetine does this by the agonism of the 5-HT1A, also by the partial agonism and antagonism of the 5-HT1B receptor, and also by the antagonism of the 5-HT3 receptor. So this is why Vortioxetine boasts its pro-cognitive effects and is very beneficial in decreasing those symptoms in depression, those symptoms of lack of attention, lack of concentration, poor memory, and even low processing speed. Vortioxetine will really benefit those target symptoms of depression. Now, with the 5-HT1A partial agonism that Vilazodone has, it's also going to increase dopamine, but that partial agonism is also beneficial for decreasing sexual dysfunction and minimizing weight gain associated with most of the other antidepressants. Now, also because of this multimodal action that both of these antidepressants possess, the effectiveness of this medication is actually often seen sooner, within 1 to 2 weeks, versus other antidepressants that take up to 2 to 4 weeks. But I always caution everyone that you should still stay on the antidepressant for at least up to 8 weeks before deciding to switch to another antidepressant, as long as you're tolerating it well and making sure that you're at a therapeutic dose of that medication. Stay on it for at least 8 weeks before determining whether or not it's working and switching to something different. So let's move on to what are they used for? Well, both are FDA approved for major depressive disorder. Vortioxetine was approved in 2013, and vortioxetine also has some off-label uses for generalized anxiety disorder and can also be used adjunctively with other antidepressants to help with those cognitive symptoms of depression that we talked about, and also in geriatric depression where the older population will have a pseudo-dementia. Vortioxetine can really go in and treat that specific symptom. Vilazodone also has some off-label uses such as generalized anxiety disorder, obsessive compulsive disorder, other anxiety disorders, and is also often used for major depression with mixed anxiety. Okay, so now let's look at the side effects of these medications. With vortioxetine, we have the common side effects as nausea, diarrhea, dry mouth, and dizziness. And then you have the sexual dysfunction, which was seen in the trials as 16 to 34%, but when you look at the placebo group, that was 14 to 20%. And so as a whole, when vortioxetine is compared to other antidepressants, there's actually a lot less sexual dysfunction reported with vortioxetine compared to your SSRIs and SNRIs. Now with Vilazodone, the common side effects are going to be diarrhea, nausea, and headaches, and only 2 to 4% will report sexual dysfunction as noted by the FDA label, and 1 to 2% report weight gain, again as noted by the FDA label. Now with vortioxetine and weight gain, it's actually considered weight neutral and no effect was seen on weight gain in the FDA trials. So on the label, it states no effect on weight gain. So let's talk about some considerations with both of these medications. So looking at vortioxetine, vortioxetine is primarily metabolized by the CYP2D6. So you want to take into account the inhibitors and inducers of that substrate, and if you're taking any of those, to make sure that you may have to increase or decrease your dose of vortioxetine and monitor for side effects. And of course, this should all be done under the direction of your provider. When looking at Vilazodone and drug interactions, Vilazodone is primarily metabolized by the CYP3A4, and so therefore when you're looking at those inhibitors and inducers, again, you may have to increase or decrease the dose of Vilazodone depending on if you're on any of these other medications, and then monitor for side effects. Again, this should be done under the direction of your provider. Now, when we're thinking about both of these medications being antidepressants and these multimodal antidepressant actions, they can actually both cause some withdrawal syndrome. So you want to make sure that you taper off of them very slowly, of course, under the direction of your provider. You also want to take caution when using these medications with other antidepressants because it can increase your risk for serotonin syndrome. And so you're going to want to monitor the signs and symptoms of serotonin syndrome. And I discussed serotonin syndrome in this video. So if you missed it, go ahead and check that one out. It would be very useful. You also want to avoid the use of those MAOI inhibitors and make sure that you haven't been on an MAOI 14 days prior to starting these medications or 21 days after the medication, just because those MAOIs can still be in your system and can cause a hypertensive crisis or even more so serotonin syndrome. Also, caution should be taken with your blood thinners, your NSAIDs, your aspirins, your ibuprofens, because of the risk of bleeding with any medications that modulate serotonin. And so just be advised of that. And if you are taking any of those medications regularly, that you talk to your doctor about assessing for signs of bleeding. And so now my final thoughts. So both Vilazodone or Viibryd and Vortioxetine or Trintellix have demonstrated efficacy in treating major depressive disorder, and that is also seen in my clinical practice. Vortioxetine definitely boasts those pro-cognitive effects, and that is noted in clinical practice. And Vilazodone, I see not so much with increasing those cognitive effects, but more so with helping patients with major depressive disorder and underlying anxiety. That is where Vilazodone really seems to work as a single medication to treat both of those symptoms very effectively. Now, there is a barrier with Vortioxetine or Trintellix here in the United States, where because it's still branded, pricing could be a barrier, and so you could be paying $400 to $500 for a 30-day supply of Vortioxetine or Trintellix. And so if you feel that this medication would be right for you, don't let that hinder you. Talk to your provider about going in and being part of the savings program that Vortioxetine or Trintellix has on their website. And after applying, see if that's something that you could benefit from. So now when it comes to these medications, when you're comparing them, what I want you to think about is think about your primary symptoms. What are those symptoms that you're trying to treat? And then look at each of these medications and say, well, if it has more efficacy to treat, say, the cognitive symptoms of depression, and that's what you're primarily struggling with, then Vortioxetine would be your choice. If you have more of that underlying anxiety, then perhaps Vilazodone would be your choice. However, I also want to caution you that we are all different on how we respond to medications. So ultimately, the best medication for you is going to be the medication that not only treats your target symptoms, but is tolerable and one that you can tolerate with minimal side effects. So there you have it. That is my overview on Vilazodone or Viibryd and Vortioxetine or Trintellix. So do you have experience with taking either of these medications? We'd love to hear about it because we learn from sharing each other's experiences. And as always, I thank you for watching. I wish you well on your mental health care journey, and I look forward to seeing you all next week.